Hi, I'm Dr. Eli Whitney, a cardiologist at the Heart and Vascular Institute of Texas. I want to talk about sleep apnea. Sleep apnea is a common disorder of sleep which has large effects on length and quality of life. Getting a good night's rest is extremely important in maintaining physical and mental health. The problem with sleep apnea is that there is failure to adequately move air in and out of the lungs while sleeping. When a person stops breathing for over 10 seconds, blood oxygen saturation drops below the normal level of 90. When this occurs, the body reacts to the low oxygen levels by increasing adrenaline levels. The sudden increase in adrenaline levels causes the person to wake up, which is usually followed by a few deep breaths, which increase the oxygen back to normal. The person then falls back asleep, and the process is repeated over and over again. Since the person only wakes up for a few seconds, the person does not remember that he or she has woken up. The problem now is that these frequent awakenings prevent the person from getting the deep sleep that is important for physiologic and psychologic health. People that have sleep apnea can spend a lot of time in bed, asleep, but the quality of their sleep is so poor that they feel tired all the time. Furthermore, sleep apnea causes important cardiovascular problems such as high blood pressure, atrial fibrillation, pulmonary hypertension, and congestive heart failure. The typical symptoms of sleep apnea include depression, feeling tired all the time even when having slept for over 8 hours, waking up in the morning after an adequate night's sleep and feeling like going right back to bed, and falling asleep during the day without trying to. Many, but not all people with sleep apnea snore loudly or are noted by their partners to stop breathing at night. Other symptoms of sleep apnea are morning headaches, waking up at night gasping for breath, excessive sweating at night, and loss of interest in sex. Other associated problems including male erectile dysfunction, personality changes, and weight gain. Many, but not all people with sleep apnea do not dream at night. The best way to diagnose sleep apnea is with a formal sleep study in a sleep lab. A good screening tool is to use an oximeter to check blood oxygen levels continuously throughout a normal night of sleep at a person's home. There are several good therapies for sleep apnea that can dramatically improve the way a person feels, as well as improve the medical problems that sleep apnea causes. The typical treatments include weight loss, CPAP, oxygen therapy, avoiding alcohol 6 hours before going to sleep, and occasionally surgical procedures. Of interest, some sleeping medications make sleep apnea worse. They make a person go to sleep, but it reduces the quality of the sleep, and the person does not get the physical and psychological benefit of the sleep. If you feel tired all the time or have some of the problems associated with sleep apnea just mentioned, and your cardiac workup does not show a significant abnormality, I recommend a screening test for sleep apnea. I hope this educational video has helped you learn more about sleep apnea, how we diagnose it, and available treatments. I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas.